Welcome to this presentation on everything you need to know about full mouth dental implants. My name is Helen. I'm the principal dentist here at Dr. Helen's Dental and Implant Studio in Prahran, East Melbourne. I've been practicing for 25 years, so I've spent more than 2 decades restoring people's smiles. I own a small single dentist practice and sadly routinely take away what nature has given people and replace their own natural teeth with a bunch of titanium implants. Just briefly on the format of this webinar, this is a recorded presentation, so if you have any questions about anything I discussed today, feel free to email us or call us later. But the format will be such that I will be answering questions that people most commonly ask about full mouth dental implants. So hopefully I can clarify everything for you. How many people in Australia do you reckon want elective radical surgery to fix their teeth in Oceania, in the world? More than vacations, boats, houses or cars. And most importantly, why do so many people need it? We know that dental health matters, but do we realise just how much it really matters until we lose it all? Poor oral health is surrounded with stigma, barriers and ethical concerns. The 2 most common reasons why people lose all their teeth are caries and periodontitis, caries being dental decay and periodontitis is gum disease. Both of these conditions are completely preventable, but by the time most people see me, it's too late to prevent them. I want to address some very important questions today in this presentation. Questions that my patients have about full mouth implant surgery and things that I think you should know before you make any radical decisions to part with what Mother Nature has given you. No fluffy adjectives, no sales pitches, just the raw information that you need to know before you proceed with full mouth implants. Just the way I tell it to my patients. Before I get into the crux of it, I'm going to introduce one of my lovely patients, Claire. Claire lost her teeth 20 years ago. She has never gotten used to full dentures. They were so uncomfortable that she would only wear them when she would go out. She took the risk on the surgery knowing that smoking could reduce success rates. But in the end, she actually ended up quitting tobacco completely. She's such an inspiration to all of us here at Dr. Helen's studio.
And people who have never lost their teeth don't realise how much it takes away. It's not just the teeth. I never used to actually look in the mirror because I didn't want to see what I had. And now I look in the mirror and I see this completely new person. But not only that, food is fantastic. When you've got dentures, it takes away a lot of the flavour of the food. And I don't know why that is, it shouldn't, but it does. And so now, when I'm munching out on food and I get the full flavour, and I can eat corn on the cob, and I can bite things, and I can enjoy doing it. I can eat nuts. And it's fabulous. It's changed my life.
So just in a few words, better than I ever would, Claire has described why people decide to do crazy things and have all their teeth replaced with dental implants. So let's get into the interesting information about full mouth implants. I want to briefly mention terms that I see in in marketing, in dental implant marketing. Teeth in 1 day, teeth in 3 days, all-on-4, all-on-6, all-on-X, full mouth implants. What do these terms mean? They all mean much the same thing. All teeth are being replaced with implants. Just very briefly, the process overview. I will cover a little bit more about the process later, but just for you to get a bit of an idea on what's involved. So the process starts with the initial consultation, then measurements are taken. On the day of the surgery, teeth are removed, implants are placed, and you end up with some sort of a temporary option, some sort of temporary teeth within 1 to 3 days after your surgery. And then another 5 to 6 months later, you get your final teeth. I want to briefly discuss the term all-on-4. You will see this commonly used in marketing. So essentially what all-on-4 refers to is that all teeth are being supported by 4 dental implants. This technique was originally pioneered by a Portuguese dentist, Paulo Malo, and the term all-on-4 was later trademarked by a Nobel Biocare Swiss implant company. I just want to say that I'm not here to promote any particular implant brand. My goal in this presentation is to purely educate and clarify confusing language. But another mention about all-on-4 implants and the actual terminology is that this concept of replacing teeth is well researched and it has shown to be successful. There are many alternative implant brands. You don't have to use Nobel Biocare implants, although original research was done with Nobel Biocare implants. But what's important is that the implant that the dentist uses is well researched. The implant system has a wide range of components suitable for full mouth implant replacements. The system is versatile and is TGA approved in Australia. What's also important is that the company is well established and will provide parts in the future if for maintenance. If your teeth break or any of the componentry breaks, that the dentist can easily and readily access parts to replace the necessary components. So there are many implant systems that are out there that meet these criteria. As mentioned, Nobel Biocare is one of them, MIS by Horizon, Straumann, Neodent, TRI, Migagen, and many, many more. So don't get bogged down too much with different implant brands. That's not the most important aspect. So what I tell my patients is trust your surgeon to use the system that they're most comfortable with to achieve the best outcome for you. Don't focus too much on the implant brand. So why do people undergo dental implant surgery? The reasons are self-explanatory. Extensive decay and advanced gum disease make it very difficult to eat. People are often embarrassed to smile and are affected in social situations. And after years of toothaches, eating soft food, and dealing with uncomfortable dentures, they usually make the decision to do something about it and replace their teeth with a more comfortable option, which is full mouth dental implants. So just as Claire said before, I can eat corn on the cob again, which was so foreign to her for about 20 years. You would be able to eat nuts, you can bite into a sandwich. And this is why 20 million people globally opt for implant surgery each year. How do full mouth implant teeth compare to dentures? Full dentures provide about 15% of natural chewing ability, while implants approach 90%. So there's a huge difference. Implants are stable, so they don't move around your mouth and they don't cause sore spots. Dentures, on the other hand, are cheaper. So if you're looking for a more cost-effective option, then dentures are the way to go. So when you're deciding about which option is best for you, weigh up all the pros and cons and decide which option suits you best. Implant surgery is a lot more involved than dentures. It's a process that takes anywhere from 3 to 6 months, sometimes even longer. If you are ready for that, then by all means, implants are for you. If you're not, then stick with dentures. Are full mouth implants right for you? They are suitable if you've lost all your teeth due to decay, grinding your teeth, or gum disease, or even trauma. But they do require a commitment to daily care, and considerations of general health and smoking habits are also important. What are the success rates with full mouth implants? This is an interesting one. If you look at marketing, dentists often say that full mouth implants carry 90 to 95% success rate. But what does this actually mean? Does success depend on various factors like implant integration or prosthetic durability or patient satisfaction or cosmetic aspects? So success is dependent on all of these, and we certainly have limitations with full mouth dental implants. I can tell you without any doubt that your natural teeth are the best and they have the highest chance of success. So if we can restore your teeth, that is your most successful option. Replacing good teeth, or in other words, restorable teeth with full mouth implants is not the best option. People often ask me, are full mouth implants permanent? So what they usually mean by that question is, are they fixed in your mouth? And the answer to that is very simple. 9 out of 10 times we can fix your teeth to these implants. So yes, you end up with a fixed option, but we can also make you removable dentures, implant retain removable dentures. Now, these are not like your old-fashioned implants. These are actually fixed to implants, so you can remove them for cleaning, but you can clip them back onto your implants and they will stay put in your mouth. They won't wobble around. I guess the second part of the question is, are they actually permanent? In other words, if you have full mouth dental implants, will they last a lifetime? If your natural teeth haven't lasted a lifetime, then there are no guarantees with dental implants. They are the second best option to your natural teeth. So again, and I will be stressing this throughout the presentation, if you can keep your natural teeth and the dentist can help you save them, that is your best option. There are no guarantees with anything we do, and there are certainly no guarantees with full mouth dental implants. Your natural teeth are still the best. What are the contraindications for full mouth dental implants? So again, I'm repeating myself. Good teeth that can be restored, or not so good teeth that can be restored. We can offer you many options such as crowns. Sometimes we can do bridges. Sometimes we can keep some of the teeth and replace individual teeth with implants rather than sacrificing all your teeth and replacing them with implants. Another one is growing children. So there are congenital conditions where children can be missing teeth. So it is an option to replace natural teeth for kids, but they need to be grown-ups. So over the age of 18, and often for girls it's over the age of 20 or 21, and for boys even sometimes into mid-20s when boys stop growing. But that's roughly the age when we would consider replacing all the teeth for kids for congenital conditions. Now, if you're a smoker or have uncontrolled diabetes, these are not necessarily contraindications for implants, but both of these conditions affect healing. So it is really important to have diabetes under control before implant surgery is performed. And if possible, I know it's easily said but not easily done, reducing or quitting smoking gives you the best chance of success. Systemic conditions such as leukemia or recent radiotherapy need to be considered before you have any dental implants, as well as medications that are commonly taken for osteoporosis, such as bisphosphonates. Another one is if you don't have enough bone in your mouth to house dental implants, so all-on-4 might not be the option for you. However, there are still options available. A bone can be grafted and regenerated, or you could consider zygomatic implants. These are really long implants that go from the mouth and anchor into this cheekbone. There is another new implant that's been available probably in the last 5 years or so. It's called the biominiature. It sounds awfully like the old miniature implant that's not very popular in dentistry, but these biominiature implants are small and they're often suitable in situations where people have limited bone, but they are sounding very promising. So some of the risks and complications of full mouth implants. Some very minor post-operative complications, I wouldn't even call them complications, I'd call them normal: swelling, bleeding, slight pain and bruising. I usually prescribe some really good medications that keep you comfortable. Another complication that can occur post-surgery is called wound opening, meaning the wound opens up, infection, sinus complications, and prosthetic fractures. Prosthetic meaning your prosthetic teeth can break all the parts that are connecting them to your implants. More serious complications, implants not integrating, or in other words, not fusing with your jaw. That doesn't mean that it's all over. Implants can be replaced. Sometimes we have to remove an implant, allow the area to heal, and then replace this implant maybe 3 months down the track. Sometimes we need to graft bone before we're able to place another implant. Probably the most serious complication is nerve damage. There is a nerve that runs in the lower jaw. There's one on each side. And if there is injury to this nerve, you could potentially end up with some sort of loss of sensation or altered sensation in the lower lip and the chin. The more experienced the surgeon is, the less likely you are to develop this complication. We'll work within millimeters of that nerve, and most of the times the nerve is unaffected. Another complication, this is a delayed complication, it's called peri-implantitis. In other words, it's gum disease associated with dental implants, very similar to gum disease associated with natural teeth, except we have very poor treatment options for peri-implantitis as opposed to periodontitis, which is gum disease associated with natural teeth. We can usually treat gum disease on natural teeth, but we have very rudimentary and poor treatment options to treat peri-implantitis. And peri-implantitis is more common in smokers or people with uncontrolled diabetes. How should you choose a surgeon for full mouth implants? This is a very intricate and involved procedure. It is really important that you have it done by an experienced and skilled surgeon. But experience and skill is important, but it's also important to work with a dentist you're comfortable with. The dentist needs to be compassionate. The dentist needs to be available to help you if there are any complications. And remember, it is a process, so you will need to see the dentist routinely for the duration of about 5 to 6 months and even afterwards. So choose an experienced dentist, but somebody you're comfortable working with also. How can you go about it? Get recommendations from a doctor, get a recommendation from a family member who's had it done. Yes, you can go online and read some reviews, but I think all of us know that we need to treat these with caution. Cheap price is not always the best, but you can also get a good bargain out there. Sometimes good dentists don't charge very high fees, and sometimes they do, but generally experienced dentists will charge a reasonable fee and not the lowest fee that's available. What would you expect? I usually say to my patients not to expect any miracles. Do expect swelling, bruising after the surgery. Do expect multiple visits. Also be very mindful that once you have the surgery and we give you your temporary teeth within 1 to 3 days, you can't actually use them to eat with for about 3 to 5 months while implants are fusing with the jawbone and your mouth is healing. And the reason for this is that if you eat prematurely, if you put any pressure on these prosthetic teeth, implants will fail. They need time to integrate and fuse with your jaw before you can actually put any load on them. And I'll talk about this a little bit later. So when can you eat? About 3 to 5 months after your surgery, but in the meantime, you'll have to eat very soft, mushy foods, mashed potatoes, mashed bananas, blended soups. And then after about 3 to 5 months, you can eat just about anything you want. So how long will the process take? As mentioned already, about 5 to 6 months in total, unless you need bone grafting to regenerate bone prior to implants, and that could add additional 7 to 9 months to the duration of the treatment. Most of the times, the All-on-4 concept actually avoids bone grafting, and that's why it was designed in the first place. So patients who didn't have enough bone in their mouth would need bone grafting, but in certain situations, or in many situations, I should say, All-on-4 concept will actually avoid grafting. It's often called the graftless process, but that isn't always the case. So I'm coming back to the process. So what's the process? And this is the way it works here at our practice. It'll be much of a muchness with other dentists, but there might be some variations to this process. So the first step is the consultation. We meet, I try to understand your concerns, I have a look at your mouth. If you have any photographs of what your teeth used to look like, what you'd like to achieve, what's important to you, these are all important things for us to discuss in that initial consultation. You will need to see how comfortable you feel with the dentist. I will have a look at your mouth. I will take lots of notes and measurements, and we can discuss the process and what to expect. Then if you decide to investigate further, we take a 3-dimensional X-ray type of scan. It's called the cone beam CT to analyze how much bone you've got in your mouth. Then if you decide to proceed, we make a preparatory appointment or even a series of those appointments. We take some photographs, take further measurements of your mouth. On the day of the surgery, you go to sleep. We take your teeth out. If you've got any teeth left, we put your implants in. This is usually done under general anesthesia while you're asleep. You wake up, you go home. In 1 to 3 days, you come back to have your temporary teeth. And for most people, these teeth are fixed, but if implants are not tight enough on the day of the surgery, sometimes you have to wear a denture for the duration of about 3 to 5 months before you can get fixed teeth. And then in about 5 to 6 months, once implants have fused with your jaw, we can replace those temporary teeth with your final teeth. And these teeth are stronger, better. They have metal reinforcement in them, and any aspects of your temporary teeth that you don't like, we can correct with your final prosthetic teeth. You might want your teeth longer, you might want them shorter, you might want them bigger, smaller, etc., etc. So it's a good opportunity. So the 5 to 6 months while you're healing, it's a good opportunity to decide what you like or don't like about your temporary teeth, and then we can correct that with your final teeth, of course, within reason. And then you enter the ongoing maintenance and care phase, where you need to see your dentist for every 6 months or so for cleans, but it's really, really important to clean your teeth on a daily basis the way we show you. And we show you fairly early on what you need to do to care for your dental implants. How would you prepare for your full mouth implant surgery? Our anaesthetist will ask you to fast for about 7 hours prior to your surgery. You need to wear comfortable clothing and arrange transportation home. If you can afford to take a couple of weeks off your work, that'll be nice. You can relax at home, but then I've seen some of our patients return back to work within a few days. Somebody who you trust needs to pick you up and look after you for the first 24 hours. Right, here's the big question. What's the cost of full mouth implants? The average cost in Australia is $25,000 to $35,000 per arch. Per arch means for the top teeth or the bottom teeth. And this will depend on who does the surgery, how experienced the clinician is, do you need bone grafting, how many implants are you having acrylic prosthetic teeth or zirconia teeth. So there are many variables, and that's why I give you the range. General anaesthetic will also cost probably anywhere from $6,000 to $9,000, but you get a very good Medicare rebate on this. You still need to expect to be a few $1,000s out of pocket, but Medicare will pay a good chunk of it. I can't tell you exactly how much, and no one can. Only Medicare will tell you, unfortunately, after the surgery, not before. But expect to be a few $1,000s out of pocket after the Medicare rebate for general anaesthesia. Affordability of dental implants is a problem in Australia. How can you afford them? We do offer payment plans. So some of these payment plans can cover the full cost of the surgery, but be mindful, as with any payment plans or any form of finance, there are some interest rates that are inbuilt. We're always trying to find a way to make it as cost effective as possible for you. There are some payment plans that are very cost effective, but they might not cover the full cost of full mouth implants. So what we usually do is, when we discuss the financial side of things, we work out the best way to help you afford this. Sometimes we do top teeth first, and a few years down the track we do the bottom, so we break it up that way, or we access one of these payment plans. Or another very popular way these days is to access superannuation on compassionate grounds, and we can help you with that. Another question is, how much will dental insurance pay? Very minimal coverage. Don't expect a lot from your dental insurance. I know you've been paying for it for many years, and you should be expecting a lot more than you will get back, unfortunately. Does Medicare pay anything for dental implants? Zilch. Medicare doesn't cover any dental treatment, but as I mentioned earlier, it does cover part of the cost for general anaesthesia. Can you be asleep for full mouth dental implants? Absolutely. In fact, 99% of full mouth surgeries are done while you're asleep. You can have it done under general anesthetic. You can have it done under local anesthetic, but sometimes it's a pretty straightforward procedure, and other times it can get more involved and lengthy. So that's entirely up to you. We generally recommend to go to sleep while you're having full mouth dental implant surgery. Another very important question, and the easiest one to answer: is it painful? I guess while you're having the surgery, you're asleep, so you don't feel anything. I prescribe you some magic medications. These are a composition of anti-inflammatories, painkillers, and antibiotics. I just about never have anyone ring back after the surgery and say that they can't manage pain. Most people come in the next day to get their temporary teeth, and they usually say that they are surprisingly comfortable and pain-free. Another important one: should you have 6 or 4 implants? The original concept of All-on-4 was centered around 4 implants replacing all your top teeth or all your bottom teeth. But in more recent years, 6 implants has become more popular, and the reason being is that they offer better support. Imagine you've got a long bridge and you've got 4 support beams supporting it, or you've got 6. Naturally, 6 is going to be better. The chewing forces will be distributed better to those implants, but 6 implants might cost more, so be mindful of that. If you can afford 6 implants and your mouth can accommodate 6 implants, then I do recommend to go for 6 rather than 4. Another very important question: due to affordability issues of generally dental services in Australia, people often go overseas to have the implants done. Can you have your dental implants done overseas? Of course you can. There are many good surgeons all over the world. Australia isn't the only country where we have high standards of care, but there are lots and lots of things to be mindful of. Some of you might say that I'm a dentist and I've got an interest in telling you this, and yes, I've got an interest in informing you accurately, but ultimately, if you choose to go overseas, that is one of many choices that's available to people now. But these are the things to consider. So the surgery doesn't take one day. It's a process that takes about 6 months. If you're going to live in the country where you're having the implants done, then by all means have it done there. Don't go to another country. Or, I shouldn't say you don't go to another country. You can go to another country, but you're increasing your risk quite significantly. How would you go about finding a good surgeon overseas? I simply don't know. If I needed to have a procedure done overseas, I wouldn't know how to select a good surgeon. Do you select them by their good marketing? Do you select them by your friend's recommendation? I wouldn't know. I know that I couldn't select a dentist purely through their marketing. If you develop a complication after the surgery and you need to fly back to Australia, who's going to help you? That's another really important consideration. Even if the best surgeon in the world performs your surgery, who's going to help you if you develop a complication afterwards? What often happens is that Australian surgeons don't know how to help you. There are many different brands of implants all over the world. We have access to some of those brands in Australia and we don't to others. So a well-intending surgeon here in Australia might not be able to help you, or they simply might not want to get involved in what some other surgeon has done in another part of the world. So these are all really important considerations, because I see it all the time. People think that an implant is an implant, surgery is a surgery, and that anyone in the world can help them if there are any complications. That's not true. What are the cost considerations? So the main reason why people go overseas is because the surgery is cheaper there. Keep in mind that you should be staying there for quite some time, so accommodation and flights need to be taken into account. Why would you have it in Australia? If you live in Australia, it's the best place to have the surgery done. But another really significant thing to consider is that we do have very high standards of care in Australia, as well as many other countries, Israel, Switzerland, Germany, Japan. Some of these countries are well advanced. Korea, I should also mention. If you have your dental implants in any of these countries, then you probably are doing it in a country with very, very high standards of care, and you're not risking a lot. But I recommend that you stay there for quite some time, at least for the duration of the healing process before you return back to Australia. So whether you have your implants done overseas or in Australia is entirely up to you. The world is an open place and you've got all these options these days, but you really need to weigh up the risks and decide how much risk you're prepared to take before you make this decision. What are the prosthetic options? Prosthetic meaning the actual teeth that you see in your mouth. What options do we have? The most common and the most cost effective is acrylic teeth on titanium bar or titanium support. These are good, but there is also a stronger option, which is zirconia bridge. So it is an upgrade from acrylic teeth. It's not a very costly upgrade. It only costs $1,500 to $2,000 more than acrylic teeth. They are stronger, they are durable, but both of these options can break. None of these options are completely fracture proof. But for people who grind their teeth, I usually recommend to invest in the stronger option. And you can have zirconia teeth at the top and acrylic teeth at the bottom. You can mix and match. We usually discuss these with you. There are also recommendations that I would make in this regard once I assess your mouth. So if you grind your teeth, I might recommend zirconia teeth. We're getting better with these prosthetic teeth, but something to consider is that if acrylic teeth break, they are actually easier and cheaper to repair than zirconia teeth. Zirconia teeth simply cannot be repaired. The zirconia part of the bridge would need to be completely replaced, but the titanium bar that they sit on can usually be retained and reused. There is another interesting option that's not very popular these days. It used to be metal fused to porcelain. It is what the term would suggest. Porcelain covers metal underneath. This is the way we used to make crowns in the past. It is a strong and durable option. One advantage of this is that teeth are built individually rather than one piece. And if a tooth breaks, it can easily be removed and replaced with a crown. But the replacement of that crown would usually approach the replacement of the whole zirconia and acrylic on the other two options. To make these, you'd be paying, $30,000, $40,000 sometimes just to make the bridge. That doesn't include implants. So you can see why this is no longer a popular option as we're getting better with the other two materials. You can also have an implant supported denture. So a denture is not a fixed bridge. It is a denture made out of acrylic, clips onto your implants. It feels very comfortable once it clips on. It doesn't move around and rub your gums like a normal denture would, but the advantage of this is that you can remove it and clean it. You can also take it out at night in your sleep. If you grind your teeth, you can take it out so that you haven't got anything to grind on. Most people have fixed teeth, but occasionally we recommend removable implant retained dentures. What sort of maintenance is involved in full mouth dental implants? Firstly, it is really, really, really important to look after your implants. If you allow plaque to accumulate around your implants, you will develop a condition that's called peri-implantitis. I mentioned it earlier. We have very poor treatments for this condition, so it is crucial that you make a commitment to look after them. You pay so much for these teeth. I want them to stay in your mouth, and I'm sure you do too. I commit to what needs to be done to achieve a good outcome, and you need to commit to looking after your implants. It is not difficult. It takes 6 seconds a day to clean each implant. And if you do that, the chances of long success are good. If you smoke, I mentioned it earlier, please do your best to quit smoking, and even if you reduce it, that's better than nothing. Smoking can increase the risk of implant failure and peri-implantitis. If your dentist tells you that you grind your teeth at night, it is really important to wear a protective night guard that's called an occlusal splint. It minimises fractures and it minimises complications with your implants. You can brush your teeth or the implant retained bridge just to keep them nice and clean, but what's more important than that is that you floss around your implants. I've put together a short video on how to care for your dental implants, and you can have a look at that. Another really interesting question that people ask, what's the warranty on this procedure? Implants are very expensive and they should be durable, but the reality is they are not perfect. And if you're expecting them to be better than your natural teeth, you will be very disappointed. They are the next best thing after your natural teeth. They're certainly better than dentures, but they're never as good and as strong as your natural teeth. Full mouth implants are always a compromise. And they can break, cheap implants can fail from time to time. But if you have lost all your teeth and you're wearing dentures or your teeth are about to come out, then you certainly will be better off with full mouth dental implants than without them. But overall success will depend on how well they're placed in the first place, how good of a job the surgeon does, and how well you look after them. Full mouth implants are a bit of a miracle. I still pinch myself to believe that we can replace teeth like that we can replace body parts, and no one would know. They would look like your natural teeth, but they are still a compromise. They're still like a false leg, and we are not as good at them as we will be in the future. So it's a long-winded way of explaining that there are absolutely no guarantees on these procedures, other than if your prosthetic teeth break, acrylic teeth within the first, if they break within the first 12 months, then we will replace your teeth. Zirconia teeth have longer warranty, up to 2 years. But the better you look after them, the longer they will last you. And that is the best form of guarantee for your implants. So to wrap up this presentation, I want to finish it on a lovely note with another one of my patient Xavier. Xavier was petrified of dentists, and the decision to have his teeth replaced with implants was not an easy one for him. So just listen for a few minutes to what Xavier has to say.
Look, it's wonderful to where I was, and the funny thing is, over time you tend to forget all the uncomfort and discomfort, I should say, that I went through such having bad teeth and a lack of teeth, and got to a stage where I couldn't really eat. I had to be very careful and aware, and I would not go out because I didn't want to speak. You know, lucky I've been told a high lip line, so it covered most of my upper teeth. But I was really aware of not laughing or covering my mouth. And that's all gone. The transformation is incredible. I mean, the first time when Helen, you put on the temporary ones, I mean, I cried. It was, I feel like crying again now. It was just an incredible transformation. And now I'm used to it. But now with the final ones, I can feel the extra teeth at the back, and the transformation is amazing, just for me as a person, and to be able to go out and socialise with friends and not be afraid to laugh or smile is incredible. Worth every penny, worth every moment of anxiety, pain, whatever. Absolutely. And thank you.
So this completes my presentation on full mouth dental implants and the most commonly asked questions. I hope I've covered everything you wanted to know. If you have any questions, feel free to give us a call or email us. And thank you for listening.